Imagine a surgeon, not standing over a patient, but seated at a console, guiding robotic arms with unmatched precision. Every movement is translated into life-saving maneuvers deep inside the body. This is not science fiction, but modern medicine. The goal? To give surgeons superhuman abilities, eliminating hand tremors, magnifying vision, and enabling movements finer than a human hair. Engineers and doctors have built machines that extend a surgeon's skills, turning once impossible procedures into routine, minimally invasive operations. The robot doesn't replace the surgeon. It empowers them, acting as an extension of their expertise. This partnership between human intellect and machine precision is redefining surgery. Through advanced robotics and high-definition imaging, the scalpel is now guided by a seamless human-machine interface. This technology is already saving lives and promises even more remarkable advancements ahead. When 55-year-old John was diagnosed with prostate cancer, he faced a challenging moment. Traditionally, this meant major open surgery with a long, painful recovery. But his surgeon offered an innovative alternative: a robot-assisted prostatectomy using the Da Vinci surgical system. Through just a few tiny incisions, the surgeon operates from a nearby console, controlling the Da Vinci's robotic arms. One arm holds a high-definition 3D camera, providing a magnified, crystal-clear view. The others use specialized wristed instruments that mimic the human hand, but with even greater tremor-free precision. This technology allows for the meticulous removal of cancerous tissue, while carefully sparing delicate nerves crucial for maintaining urinary and sexual function. The magnified 3D view and tremor-free instruments ensure unparalleled accuracy, making a critical difference in the outcome. John's recovery was remarkably swift. He experienced significantly less pain and was able to return home in just a few days. Within weeks, he was back to enjoying his normal life, his quality of life fully preserved. Stories like John's are increasingly common as robotic technology redefines what's possible in surgery. The Da Vinci system empowers surgeons to perform complex procedures, leading to improved outcomes, reduced complications, and significantly faster recoveries for patients worldwide. Surgical robots represent a significant leap forward in medical technology. They come in many forms, each meticulously engineered to enhance surgical precision and patient outcomes. These advanced machines are each designed for specific tasks, ranging from minimally invasive procedures to complex reconstructive surgeries. One prominent type is the master-slave system, exemplified by the Da Vinci surgical system. This technology allows surgeons to perform operations with enhanced dexterity and control. The master-slave system lets surgeons control robotic arms from a console, often located a short distance from the patient, providing an ergonomic and comfortable operating environment. The surgeon's hand movements are translated into precise actions by the robotic arms, offering unparalleled accuracy and minimizing trauma to the patient. In contrast to master-slave systems, active robotic systems, such as RoboDoc, represent a different approach to surgical robotics. These systems can autonomously perform specific tasks, like bone milling, with pre-programmed precision. This is particularly useful for joint replacements, ensuring accurate implant placement, but always under the watchful eye and supervision of a skilled surgeon. Then there are handheld robotic devices, which act as smart tools, enhancing a surgeon's capabilities during intricate procedures. These devices offer features like stabilizing a surgeon's hand, effectively filtering out tremors, which is invaluable for delicate microsurgery requiring extreme precision. Furthermore, flexible robotic endoscopes represent another category, capable of navigating the body's natural pathways with ease. This allows surgeons to reach areas that were once inaccessible without extensive incisions, significantly reducing patient recovery time and discomfort. Each type of surgical robot addresses unique surgical challenges, offering tailored solutions for a wide range of medical conditions. The ultimate goal is to provide safer, less invasive, and more effective procedures, leading to improved patient outcomes and a higher quality of life. From comprehensive surgical systems to highly specialized tools, the field of robotic surgery is constantly evolving and expanding. Ultimately, robotic surgery is about expanding what's possible in the operating room, pushing the boundaries of medical innovation and patient care. The diversity of these robots means more tailored solutions for patients, allowing surgeons to select the most appropriate technology for each individual case. Looking ahead, the future holds even more specialized and accessible robotic options, promising to further revolutionize the field of surgery and improve patient care worldwide. When we consider surgical options, it's essential to weigh the benefits and drawbacks of each approach. Let's compare robot-assisted surgery to traditional open surgery. And when we look at the data, the advantages are clear. Robotic surgery uses small incisions, often just a few millimeters in length, significantly reducing blood loss during the procedure, and consequently, lowering the risk of infection and post-operative pain. Enhanced visualization, with high-definition 3D imaging and unparalleled precision, help surgeons avoid delicate nerves and tissues, minimizing trauma to surrounding areas, ultimately lowering complication rates. Recovery is faster. Patients are often back on their feet much sooner. Patients experience less pain, leading to a more comfortable recovery period, and as a result, need fewer narcotics for pain management, and are often able to leave the hospital sooner. Shorter stays mean lower costs for both the patient and the healthcare system, and fewer hospital-acquired infections, further reducing expenses and improving patient outcomes. The robot's magnified view provides surgeons with a level of detail that is simply not possible with the naked eye, and wristed instruments mimic the dexterity of the human hand, but with a greater range of motion, allowing for more precise removal of diseased tissue, targeting only the affected areas, and better preservation of healthy structures, minimizing damage to surrounding organs and tissues. For many procedures, particularly complex ones, this means better cancer control, with more complete removal of tumors and improved functional outcomes, allowing patients to return to their normal lives more quickly. While open surgery still has its place in certain situations, the trend in surgical innovation is clear: smaller, smarter, more precise, and ultimately, safer for the patient. This approach to surgery is rapidly becoming the new standard of care. The goal is not just to fix the problem at hand, but to do so with minimal impact on the patient's body and to promote maximum recovery and long-term well-being. Robotic surgery is setting a new bar for patient care, offering a future where surgical procedures are less invasive, more precise, and lead to better outcomes for everyone. Why are hospitals investing millions in surgical robots? Patient demand and competition play a big role. Hospitals offering robotic surgery are seen as leaders in innovation, attracting more patients and top surgical talent. For surgeons, robotics means less physical strain and fatigue, leading to better focus and safer care. Data shows robotic surgery leads to shorter hospital stays, fewer complications, and lower readmission rates. This boosts hospital efficiency and quality, making the investment worthwhile. Robotic programs also foster research and innovation, opening doors to new techniques and clinical trials. Hospitals with these systems gain prestige, research opportunities, and collaborations. Investing in robotics is about elevating care, supporting surgical teams, and staying at the forefront of medicine. It's more than equipment. It's a platform for progress. Robotic surgery is shaping the future of healthcare institutions. Robotic surgery brings challenges, starting with a steep learning curve for surgeons. Mastering these systems requires extensive training and practice to ensure patient safety. The high cost of robots and ongoing expenses can limit access, especially for smaller hospitals. This creates disparities in care that must be addressed as technology advances. Another challenge is the lack of tactile feedback. Surgeons must rely on visual cues instead of touch. Researchers are working on advanced haptic systems, but for now, adaptation is key. Robotic surgery is a team effort involving surgeons, assistants, anesthesiologists, and nurses. Seamless communication and teamwork are essential for success and safety. The human element remains at the heart of every robotic procedure. Technology empowers, but people make it work. Today's surgical robots are just the beginning, a mere glimpse into what's truly possible, of a technological revolution that is rapidly unfolding before our very eyes. The future promises smaller, more precise tools, smarter, more intuitive systems, and more flexible robots, adapting to the complexities of the human body, capable of single port or even surgery, minimizing trauma and accelerating recovery. Artificial intelligence will soon guide surgeons in real time, highlighting critical structures and suggesting optimal paths. Telesurgery could allow experts to operate from anywhere, breaking down barriers to care worldwide. These advancements will democratize access and transform global healthcare. The story of robotic surgery is one of relentless innovation and human ingenuity. The partnership between surgeon and machine is redefining the art of healing. The future of surgery is being written now, and it's extraordinary. If you enjoyed this video, don't forget to subscribe to my channel, Dream Intel, for more.